Welcome to Conversations on Healthcare. This week's guest is Gary Cohen, award-winning founder of Healthcare Without Harm, seeking to eliminate toxic waste from the healthcare system and bring the industry to a net zero emissions status. Now, here's Mark Masselli and Margaret Flinter.
We're speaking today with Gary Cohen, founder and president of Healthcare Without Harm, an international organization promoting environmentally responsible healthcare. He's built a coalition and networks in more than 70 countries dedicated to reducing the impact of health industry pollution on climate change and health.
His work has earned him the MacArthur Foundation's Genius Grant, the White House Champion of Change Award, and the Skoll Foundation Social Entrepreneurship Award. He just presented at the UN's COP26 Climate Summit in Glasgow. Gary, welcome back to Conversations on Healthcare.
Thanks very much for having me.
Well, and we had you just after you got the MacArthur Award years ago. That's still glowing, and at least in our minds. So again, congratulations on that. And all eyes were on Glasgow recently. The world leaders came together for the UN COP26 summit to address climate change. And a number of commitments were made to bring us closer to net zero carbon emissions globally. What do you think about the agreement? I know there was some controversy as India and China in the end had some language change around coal. But tell us what the outcome was and what, in your mind, was the most significant agreement to come out of the gathering.
Yeah, so I would say the overall conference was a mixed bag. So on the one hand, the level of ambition required to keep the planet warming from being catastrophic, we didn't get there. So the commitments that were made fall short of the desire and the need to keep temperatures within 1.5 degrees centigrade. In fact, the commitments would actually increase global temperatures potentially up to 4 degrees Fahrenheit, which is 2.4 degrees centigrade. And that's abstract, but the point is this, is at 2 degrees centigrade, which is about 3.5 degrees Fahrenheit, the estimates are that it will expose 1 billion people on the planet to extreme heat. However, there were some positive things that happened there. There was a strong commitment to stop deforestation. There was a strong commitment of 30 different countries to stop selling fossil fuel-based, gas-powered or diesel-powered cars by 2040. And companies, committed to that. Ford, General Motors, Mercedes-Benz, Volvo. Other car companies didn't commit to that, including Toyota, Volkswagen, and Nissan. In our space, more than 51 countries committed to a health program that we established with the World Health Organization and the British government, which was the COP presidency, which was to say that they committed to make their healthcare systems climate resilient to the extreme weather that we're all facing, and also to decarbonize their healthcare systems. So in an interesting way, healthcare for the very first time really came to this event and made very serious commitments to address its role. So that was huge.
Well, Gary, at the COP26, you were with another recent guest of ours, Assistant HHS Secretary Rachel Levine, and talking about this very critical issue of the role that climate change is already playing in health inequity. And you've said that the Biden administration's new initiatives will address what you call the moral wound of health inequity that is now fueled or accelerated by climate change. Maybe talk with us about the role of climate change in health equity and contributing to health inequity, and how do you see these initiatives having an impact in that area?
Right. So what we learned from COVID, and we're seeing in the climate crisis as well, is that exposed all the racial and social inequities that we face in our society. Black people died at twice the rate of white people. Native people died at 3 times the rate of white people. People who were vulnerable already, who had pre-existing conditions, especially respiratory conditions, were more likely to die. And if you look at the climate crisis, we see that force multiplier playing out in the same way. So that the most polluted communities in America, many of them are in communities of color. If you look where the petrochemical plants are, where a lot of the refineries are, where a lot of the incinerators are, where a lot of the lead in paint in housing is, where the truck routes are, where there's a lack of tree cover because of decades of redlining. Those are all symptoms and consequences of structural racism in the country. So in some neighborhoods of Baltimore in the summer, it's 5 or 10 degrees hotter because there is no tree cover. So as we start to understand the impacts, the health impacts of the climate crisis on our country, it runs right into our racial reckoning as a nation. And so that as we decarbonize, as we move away from our reliance on fossil fuels, we also have this incredible opportunity to heal some of the racism that we've lived with for generations. And that's the special role of the healthcare sector in developing that. And it's also, thankfully, a goal of the Biden administration, where they want to put some of their investments in clean energy and addressing the decades of environmental injustice in those communities, put some of the money to address those injustices and right those communities, invest some of the clean energy strategies in those communities. So that's the first time we have a government in this country that's centering itself in climate solutions and centering itself in racial equity.
Well, I want to pull the thread on that, and thank you so much for shining a light on that particular inequity that people who live in poverty, the BIPOC community, live in day in and day out. I want to move away from the sort of global focus to more what's happening domestically. And the president this week on the White House lawn signed a bipartisan $1.2 trillion infrastructure bill. It really, I think, did a lot. There obviously, in bipartisan bills, there are always shortcomings, but help our listeners understand what is so vitally important for climate change in that legislation. And also, on deck is the Build Back Better bill that's hopefully coming out of the House and then over to the Senate. What's at stake here? One, what's in the bill that you're excited about that the president signed, and what's possible in the potential of infrastructure, another human infrastructure bill, if you will, or a first human infrastructure bill?
Yeah. Well, so it's the infrastructure bill that did pass and that's been signed creates some important upgrades in clean energy and transportation sectors. It includes electric grid modernization, electric vehicle charging infrastructure, some kind of community infrastructure resilience, some kind of carbon management and research into new technologies. So it goes a piece of the way, but the real transformation is in this other Build Back Better bill, which would put the United States on a very robust pathway to move toward a clean energy economy in many dimensions. There's $320 billion for clean energy and transmission and vehicles and manufacturing, and there's money to address air and water pollution focused in frontline communities. There's a clean energy and sustainability accelerator, like $30 billion that would put some of these investments in disenfranchised communities, this sort of Justice 40 initiative. There's $100 billion in resilience in terms of climate smart agriculture, forestry, coastal restoration, urban parks. It's creating a whole civilian climate corps with a diverse workforce of 300,000 members, kind of a throwback to what FDR did during the Depression.
Right.
And there's another 110 billion in clean and globally competitive industrial facilities, clean energy and vehicle manufacturing. So there's so much more in that other bill that is being negotiated that would be an enormous signal to our economy, an impetus to our economy, a stimulus to our economy, and it would demonstrate enormous leadership to the world that we could meet the goals that the administration has to reduce our greenhouse gas emissions by 50% from 2005 benchmark, and 100% hopefully by 2050 at the latest. So it's a big deal, and the first bill doesn't come close to doing that stimulus that's required. It would have been ideal if Biden would have been able to go to Glasgow and say, we've got that all wrapped up, but it's still being haggled over, obviously.
Right. Well, Gary, toxic waste in healthcare is certainly a big problem, and it's safe to say that people of a certain age, and probably half the people that work with us, have never seen a mercury thermometer, right? Something that was it was everywhere in healthcare and in your medicine chest, probably at home. And that was one of your most successful campaigns at Healthcare Without Harm that we all owe you a debt of gratitude, eliminating mercury thermometers across the healthcare landscape, which really were a big contributor to toxic waste. But healthcare itself is a big contributor. And in so many communities, healthcare is the biggest employer. It's a real economic engine. What are you seeing in terms of the work that the health sector and the healthcare sector can do at reversing that trend of being a contributor to toxic waste and sort of being a force for positive change in this area?
Yeah, well, so the amazing thing about the health sector in this country is that it's the biggest part of the economy besides the U.S. military. It's 18% of the entire economy, and it's the one part of the economy that lives within this ethical framework of the Hippocratic Oath to do no harm. And so there's this opportunity to, as it's addressing its toxic footprint, its climate footprint, it can achieve health outcomes that are positive all along the way. That's the benefit. It's that we can actually improve the health of all Americans by addressing our reliance on fossil fuels, for example, because fossil fuels, independent of their climate contribution, globally are killing 8 million people a year because of the particulate matter, according to the Harvard School of Public Health. That's more than AIDS, malaria, and tuberculosis combined. So just cleaning up the air and moving away from coal and oil and gas will actually improve Americans' health. Also, healthcare is a huge user of petrochemical plastics, which are choking our waterways, which are full of toxic chemicals and additives, which create dioxin when they're burned, many of them, PVC, for example. And so moving away from petrochemical plastics, which also is another sink for fossil fuels, can help stimulate a green chemistry economy to move away from those. As we move away also from the over-reliance on meat, for example, hospitals buy a lot of meat for their patients. If we move to a little more plant-based diets, it's good for people's health, it's good for agriculture, it's good for the planet. So there's a lot of different interventions that hospitals and healthcare can make and aggregate its power to signal the rest of the economy of the direction we need to go. And because they are anchors in their community, they're economic engines, we are working with them to say, as you're doing energy efficiency in your own facilities, support energy efficiency in low-income housing in your community so that you reduce the incidence of asthma and respiratory disease. As you're offering healthier food for your patients on their trays and your employees and your visitors, support more local, sustainable, and equitable farming that's more climate resilient, that doesn't use pesticides. Support more sustainable transportation so that there's less congestion coming in and out of the hospitals. So there's ways in which they can see themselves as sort of the epicenter of creating healing beyond their four walls into the communities they serve and into the planet that sustains us all. Because what healthcare needs to come to grips with now is that it needs to operate at three levels: at the individual's health, the community's health, and the planet's health.
We're speaking today with Gary Cohen, founder and president of Healthcare Without Harm, seeking to mobilize the healthcare sector to address the climate crisis as a medical emergency and to decarbonize healthcare. You know, Gary, I was listening to you sort of, I don't want to steal the president's thunder here, but sort of a build back better for the healthcare system strategy. And you're really talking about some of the operational elements of it, but the whole design of the health system seems to be in need of a change. The pandemic has certainly provided some opportunities to be a force multiplier, both in terms of access to healthcare, but also in terms of our carbon footprint. Telehealth being one of them, right? People do not have to drive in. Now, we're in the primary care side, not the inpatient side. And I would just, and I know you have a keen focus on hospitals, but really the whole healthcare system, certainly the role community health centers play, 1,500 of them, 10,000 locations. And guess what? All those locations are in those targeted, environmentally sensitive neighborhoods that you talked about. But what about the design of the system? I think you're certainly going for the right low-hanging fruit, which is the purchasing, the buildings that they're building, making them more environmentally friendly. But isn't it that we have to sort of reimagine the delivery system in ways that use distant communication so patients can be monitored? What are your thoughts on that? Who would you say is a best practice?
Yeah. So, I mean, you're exactly right. We have to redesign the healthcare system so that it's not focused essentially on treating chronic disease in people once they come. So they're always at the end of the pipe. They're always sort of in the mop-up operation. We've got a society that has got structural racism, it's got vast amounts of unemployment, it has polluted environments, it has toxic stress for lots of people. People are struggling, and we have chronic disease. And so the healthcare sector is at the back end of this system. And what it needs to do is it needs to be about health, creating health, as opposed to just treating disease. And that means changing the financing and the incentive system to move upstream and address the housing, address the food systems, address the violence, address the pollution in communities that are making people sick in the first place. That's a fundamental redesign. And because we are facing this climate crisis, it needs to anchor the resilience of communities. So it's not only does it need to be the last building standing in the next Hurricane Katrina or Hurricane Sandy or wildfires in California, but it needs to understand the vulnerabilities of the communities that it serves. Who is on respirators? Who is on ventilators? Where are the communities that are already living with air pollution so that if there's wildflowers, it's going to be much worse? So there's a kind of a redesign in culture and in thinking and financing so that we're using this money to create health. We need to create health. And so there's some important kinds of mechanisms that we need to instill at the highest level of the Department of Health and Human Services that does that. Like a small thing, but it would be a big thing, honestly, is if we said to every hospital in America, you do emergency planning, that's great, but you need to do climate resilience planning because there's new realities, heat, stress, wildfires, hurricanes. You need to understand the vulnerabilities of your community, the social determinants of health. In order to get Medicare reimbursement, you need to measure your carbon footprint and make progress toward the goals of the Biden administration. In order to get reimbursements, you need to do things that are actually creating health in the communities you serve. There's some very, very fundamental problems with our healthcare system that need to be replicated. I'd say the system that has the potential and the mindset to make this transition is the Kaiser Permanente, because it's both a health insurer and it runs hospitals and clinics. So from the point of view of a membership of a health insurance agency, they want to keep people healthy, saves them money. And so they don't want people showing up in their emergency rooms. The other system is the Veterans Administration. It's a system we control. And so we have a strong national interest in helping veterans be healthy and deal with the trauma that they come with from being in Iraq and Afghanistan and other places. So, I mean, having control over of the entire system and a population gives the system a chance to actually promote health as opposed to just treat disease.
Well, I think you're absolutely right, Gary. And I think, as Mark alluded to earlier, I'm going to add to your list. And we often say Kaiser, Veteran Affairs, and the Community Health Center movement, 29 million patients, 1,300 organizations, and thousands of sites. These are all leverage points. And I think you're absolutely right. We need to push those levers to get the results that we want. And one of the partners that you have that we were interested in hearing about is the National Academy of Medicine, which is looking to address climate change in the healthcare setting. A big piece of this is going to be about how we train the next generation of healthcare providers. And one thing we have on our side, I think, is young people tend to come to us pretty environment aware, climate aware, with a bit of an activist format. But what's your vision for how the work of the National Academy of Medicine and their platform to address climate change in the healthcare setting? What's your vision for that approach? And what do you think some of the outcomes of that might be, even in the short term, given that we don't have all the time in the world on this one?
Yeah. So I think the National Academy is got a strong focus on decarbonizing healthcare, on making it climate resilient. And in that decarbonization, focusing on equity issues, so that, as I've said, how can we address health and racial inequities as we're decarbonizing? And the other dimension of their initiative is how can we educate the next generation of clinicians, doctors, nurses, and others, and I would add the current generation is to make them advocates. Make them messengers for changing the narrative around the climate crisis, so it's not seen as polar bears on melting ice caps, et cetera, and glaciers, but it's about asthma, it's about heat stress, it's about wildfire, it's about the health of our families. And they've done a lot of opinion research around climate, and it turns out, understandably, that when you focus on health, people care because they care about their own health, they care about their family's health, and they're more likely to act. And so inside of that narrative, new narrative, health professionals are the best messengers. And what COVID showed us is that they're truth tellers. When you have politicians lying about the severity of COVID or telling you to do some cockamamie kind of solutions that aren't going to be good for you, the public health and health professionals in the countries have been truth tellers. It's like, no, we're going to give you the real story, the real advice. And so we want to leverage that trusted voice for climate solutions, because it may be that health may be the one lever, in addition to jobs, that helps to unlock the partisan divide in the country and say, yeah, actually, we all care about health, don't we, in our society? So the National Academy of Medicine is been incredibly helpful because they're convening all of these incredibly important players, including the federal government, to say, let's solve this together. The American Hospital Association, the American Medical Association, all these big industries that are supplying healthcare, the Joint Commission, Center for Medicare and Medicaid. So the right parties are at the table to actually do some of the redesign you were talking about, and accelerating this transformation, because we don't have a lot of time. We need to make this change in a very profound way over the next decade.
Gary, I think our listeners are asking themselves, I'm really like what I'm hearing. Tell me more about how I can participate in healthcare without harm, or you talked about the need for advocates. So maybe lay out some opportunities for people, starting with the organization that you founded.
Yeah, so healthcare without harm has a lot of tools and strategies and case studies that demonstrate that there's so many ways to enter into changing the healthcare system, from food to energy to buildings to plastics to waste to it goes on and on, to water. And so for people that are in the sector, there's lots of places to engage and to advocate within the systems they're operating in, whether that's a clinic or whether that's an acute care hospital, to make this kind of transformation. In the clinical advocacy space, there's a number of initiatives that exist. We launched with an organization called the Alliance of Nurses for a Healthy Environment, a thing called the Nurses Climate Challenge. And it's a whole website with materials and op-eds and ways to engage people in the facilities you work in, but also to become advocates in the communities that you serve, to bring that trusted voice forward. There's a partner organization called the Medical Society Consortium on Climate and Health that's got half of the physician organizations in the country all at least signing on to climate as a strategic imperative. And there's lots of materials in those places and in others to get engaged and to short circuit our learning curve, so that we are bringing forward health professionals as heroes, literally, for the planet, as planetary healers. And then there's so many other opportunities for just engaging in your local community. Like everybody says, well, what can I do as an individual? I would say, what can you do as a community? Like, band together. There's all these, renewable energy standards that are coming at local levels and state levels. There's so many different resilience initiatives that are developing all around the country. So there's ways to engage wherever you find yourself.
We've been speaking today with Gary Cohen, founder and president of Healthcare Without Harm, an international campaign that promotes environmentally responsible healthcare. Learn more about his award-winning work by going to noharm.org or follow them on Twitter at HCWH Global. Gary, we want to thank you for your vision, your leadership, your passion for addressing healthcare within the context of climate change, for your commitment to building a healthier planet while addressing the crushing weight of health inequity. And we want to thank you for joining us again today on Conversations on Healthcare.
Thanks so much for having me.